The complete examination of a canine patient. Part 2. Patient signalment, history, and subjective observations. In Part 1 of this series, we discussed the importance of the physical examination as a diagnostic tool and thorough documentation being essential to the process. We will begin the exam with patient signalment, history, and subjective observations. Signalment. The first step in the complete physical examination is to consider patient signalment. Signalment is a complete description of the patient, including species, breed, age and date of birth, sex, and reproductive status, whether the animal is neutered or intact. This data may already be filled out on a computer-generated examination form, or they may be on the patient record. Verify that they are correct every time the patient is seen. Never assume that the client knows for certain the reproductive status of the animal without verifying a spay or neuter date of surgery in the patient history. Signalment is as important as clinical observations when determining a set of differential diagnoses. Patient history. The next step is to obtain and confirm the patient's medical history. It is important to establish the owner's primary medical complaint and document it on the physical examination reporting form. Note the symptoms that the owner has observed, the frequency and duration of the symptoms, and any contributing factors that will clarify the nature of the problem. Once this has been clearly established, a broader history must be taken. Taking history must include a vaccination history, heartworm status, past illnesses and ongoing symptoms, prior ownership and geographic origin of the pet, recent traumatic events, environmental and nutritional deficits, breeding history, and current medications that the patient is receiving. Let's follow Dr. Huber as he performs a physical exam on a canine patient.
I'm Dr. Huber again. Hi, nice to see you again. And this is Winnie. Yeah, hi Winnie. And it looks like we were here for our annual exam today. So that's good. She's been a good girl. Yeah. So we have her in our system as a spayed female. Is that correct?
Yes.
All right, very good. And looks like she's about 7 years old?
Yes.
Okay, very good, very good. Hey, Winnie, how you doing? So, at home, has she been on a heartworm and flea prevention product?
She is on both,
okay.
yes.
Okay, very good, yeah. And relative to her environment, I guess, how about, could you go to parks, baseball areas, doggy parks, anything like that?
Yes, we go to the park all the time, and
okay.
She's at doggy parks a lot.
Oh, okay, all right. So we get out a little bit, we have some fun. All right, very good, very good. Those are the kind of things we need to know so we can make sure we have her protected correctly with certain vaccines and recommendations for her.
Dietary history is also very important. Note the pet's diet and dietary indiscretions. Document any recent changes to the diet and whether the pet has received table scraps. This information is often critical to a thorough patient history. Medication history is also important. Identify if the patient has taken any over-the-counter medications prior to the visit. Note if the patient is currently on any prescription medications. Identify if the patient has had any adverse reactions to medications in the past. Subjective observations of the pet. Keen observation skills are an essential component of the physical exam. We begin by observing the pet and his or her behavior from the moment they enter the exam room. This observation and general assessment will include the subjective appearance of the patient. Observe and record the pet's body condition. Check the coat for good grooming habits or an unkempt appearance. Symmetry of carriage. Check for any asymmetry of body shape and extremities. Proportion of size. The pet should be typical for the breed. Note any severe heritable anomalies in skeletal structure. Body condition scoring should also be assessed through keen observation and through feeling the pet's body. Body condition score can be evaluated using a 1 to 5 scale or a 1 to 9 scale. In this example, we use a 1 to 9 scale. 1. Emaciated. No fat over ribs. Raised tailbone and peak of spine. severe abdominal tuck. 3. Underweight. Ribs easily palpable with minimal fat covering. Easily palpable spine. Abdomen tucked. 5. Ideal. Ribs palpable. Tailbone smooth. Peak of spine palpable. Hourglass figure. Lumbar weight. 7. Overweight. Ribs difficult to palpate. Fat pad over tailbone. No abdominal tuck or lumbar waist. Tube-shaped. 9. Obese. Rolls of flesh over neck. Ribs impalpable. Tailbone impalpable. Pendulous bulge at abdomen. Bullet-shaped from above. Observe the subjective hydration status. Increased skin turgor, and thus dehydration, is identified as a loss of elasticity when the skin over the thorax is lifted and released. Skin tinting of the upper eyelids indicates significant dehydration.
You're going to check for her hydration, which is where we pull up the skin to make sure she's doing fine there. I guess at home she seems to be drinking water adequately.
Yes.
Not excessively. No problems with urination frequency or anything like that?
Not that I've
Okay,
seen.
all right. So her hydration seems to be good today. Her body condition score as far as, weight and muscle mass and fat levels, I mean, there's a few things we do, and when we try to do this, we assess a few different points. And so we're going to look to see if, where we can feel the backbone, which we can without having to push hard. That's a good thing. And we're going to feel the ribs, where we can feel the ribs individually without, again, having to push down to palpate those ribs. That's a good thing. The other thing we're going to look for is what we call an abdominal tuck, where their chest is lower than their caudal abdomen, where there's a little bit of incline. And it's a little hard when they're laying down. We'll check that when she stands up. But from what I can tell, and when I saw her walk in, she does have a little bit of a tummy tuck there, which is a good thing, versus being the straight across dog, which is the more common. Okay? So with those two things, we're going to put her in that 5 area of a good body condition score. That's adequate.
Observe and record the attitude and mentation of the pet. Record the patient's mental status as bright, alert, and responsive, abbreviated as BAR, hyperactive, depressed, dazed or disoriented, comatose. These subjective attitude and mentation assessments will later be combined with the objective neurologic exam in the systems portion of the complete physical examination to help reveal any neurological deficits. Document any subjective characteristics of the patient during this part of the physical exam. It is not necessary, however, to document any negative answers to the questions we have discussed. For example, there is no reason to note that the patient was not comatose. In Part 3 of this series, we will record the patient's vital signs.